Welcome, everybody, and thank you for joining us today. Bonjour, bienvenue à tous. We're so glad that you could all join us today for what will be an insightful and inspirational presentation on arts-based practices in mental health research. My name is Kat Lau. I am the Knowledge Translation and Communications Lead at Access Open Minds, and I helped coordinate this webinar. And a few of my team members and I will be helping to facilitate parts of this webinar today. So this is the first part of a two-part series on arts-based approaches. So I'll talk a little bit about the second webinar at the end. But today you'll be getting an introduction to arts-based approaches along with some great real-world examples. And then we'll have a more hands-on kind of engaging segment at the end, which will give you a taste of what one of these arts-based webinars look like. So before we get started, I do want to acknowledge that we are hosting this webinar from Jotjage, or Montreal, which is located on unceded Indigenous lands. We recognize and respect the Kanien'kehá:ka as the traditional custodians of these lands and the waters on which we meet today. And this acknowledgement is really just the starting point of the efforts we need to make in order to dismantle colonial structures and to foster indigenization and reconciliation. So let's continue to honor our relationships with Indigenous and other peoples on Turtle Island or from wherever you are joining us today. So please feel free to share what part of the world you're in and where you're joining us from today in the chat. Just one last housekeeping item. Please stay on mute during the presentation so that we can give our presenters our undivided attention. You'll have the opportunities to ask questions later on in the webinar, but feel free to comment and ask your questions throughout in the chat box. N'hésitez pas à poser des questions en français aussi. Je vais partager les diapositives en anglais et en français avant chaque présentation dans le chat. So we're going to be providing links to the actual presentation slides in English and in French. So for those of you who would like to follow along that way, that will be an option. So I'll do that before the presentation starts. So without further ado, I'd like to hand it over to Vidya, who will introduce our first speaker.
Thanks, Kat. Thank you, everyone, for joining us this afternoon. It gives me great pleasure to start this webinar series by introducing Professor Katherine Boydell. I think it's been my selfish desire to have you speak, and I think it'll be really valuable to all of us. Professor Boydell is head of the Arts-Based Knowledge Translation Lab at the Black Dog Institute and director of Knowledge Translation, Sydney Partnership for Health Education Research and Enterprise. She's had a really, really long and very sort of prolific program of research and participatory collaborative research that uses arts for creation, dissemination, knowledge translation. I have been following your work for many years. And when I first moved to Canada, I was very disappointed to find out that you had left Canada to join the team in Australia. So really, she's published more than 300 papers and in a variety of ways using dance, body mapping, story completion, like many, many techniques, and really, really looking forward to your talk. Thank you, Katherine.
Thank you so much for that introduction and for inviting me to this webinar. It's really great to see all of these faces, and I'm really happy to share some of my work with you and look forward to our discussion towards the end as well, because I think it's always wonderful to hear from folks in terms of what you're doing and whether you have any questions or whatnot. So I'm going to try to share my screen here and see if it works as successfully as it did when we tried it this morning. All righty. Can everyone see my screen? Perfect. Wonderful. So I also would like to begin by acknowledging country. And I am today sitting on the wonderful and beautiful lands of the Gadigal and Bidjigal people here in Australia. And I love the acknowledgement of country because I think it really does allow us to appreciate the place and space that we're on and honor elders past, present, and emerging. And I always like to acknowledge the lived experience of people with mental health challenges, because their experiential wisdom is so critical in our research process and in the design of services and interventions, and are so integral to our work. And as Vidya mentioned, our work is very, very participatory, and we're always keen to involve in very meaningful ways people who can share with us their experiential wisdom and apply it to the entire research process. So as Vidya mentioned, I am originally from Toronto, and this is our beautiful skyline. And I often like to use this in presentations because many people on this side of the world have never been to Canada. So it's nice to give them a little bit of a flavor for the country. And I also like to show this slide because, of course, many people here in Australia have never seen snow. So this is a typical winter day, as probably many of you know, but I have to say I don't miss that. Because this is one of our local beaches that's sort of 10 minutes down the road from our medical research institute. So it's a very, very different lifestyle here. So what I wanted to do was just give you a bit of an overview of what I'm hoping to talk about. It's morning here, but I understand it's afternoon there. So I just wanted to start off with just covering a little bit of definitions around what is arts-based health research, what is arts-based knowledge translation. I want to take you on a bit of a whirlwind tour of some of my favorite installations from around the world that are evidence-based, and they are profiling incredible research projects in the overall health field. And then I want to share with you some of the research that I've conducted in my lab here in Sydney. So as many of you probably know, arts-based health research really involves using the arts at any stage of the research process. So using creative and artistic methods to explore and understand health-related issues. And this approach involves any kind of art genre, so whether it's visual arts or music, dance, theater, storytelling, multimedia installations, to really investigate and communicate health issues, whether they're experiences or perceptions or outcomes. And in our experience, and certainly in the literature, it can really provide unique insights into emotional, psychological, and social dimensions of health and illness, and often offers, I guess, more embodied knowledge that is really difficult to get from other research methods. And I think what's really exciting is that this approach has been burgeoning over the last decade or so. So it's increasingly recognized by its potential, I think, to augment existing more conventional research, but also as a knowledge translation strategy. And that's really the area that I've been most interested in, is trying to reduce that knowledge to practice gap and communicate our empirical research knowledge using these more creative techniques and methods. So arts-based knowledge translation is really referring to the artistic and creative approaches to communicate research findings to diverse audiences. And so in thinking about arts-based knowledge translation, it's really focused on knowledge creation. So using the arts in the research process, so having our research participants draw on these artistic genres to share their experiences of an illness, of an intervention, of a service or support, or even of a social context, and then to use the arts to disseminate or share that empirical knowledge with a wide variety of audiences. So in our work as researchers, we also are very interested in measuring the impact of that. So again, depending on what the research objective is, do these methods enhance mental health literacy? Do they decrease anxiety and depression? Do they enhance capacity? Do they change practice and behavior, most importantly? So our team's work has really focused on that area in terms of really building the evidence base for using the arts as a knowledge translation strategy. So I wanted to take you, as I mentioned, through a bit of a whirlwind tour of some arts-based health research from around the world. And there's some of my favorite picks that highlight work that has really strong research underpinnings. I want to go through them rather quickly to give you a sense of the breadth of the work, but all of them have associated websites, peer-reviewed articles, beautiful visuals that really give you a sense of the depth of this work and what it can offer. And so if there's any difficulty, if you're interested in any of them and have difficulty, please don't hesitate to reach out to me, and I'm happy to share any of that, because it's just incredible work. So this work here, Femme Fatale, I really find quite beautiful. It's an installation that explores the deeply complex relationship that we have with prescription drugs. And you can see in this installation that tablets and capsules have been woven into the clothing that represents different aspects of medical conditions. And so you probably can't see here, but the red-shaped heart tablets represent diabetic medication. And the whole message, or one of the main messages of this installation, is around the 82 centimeter waist, and that anything greater than that, there are difficulties and health problems. And the research highlighted that women with waist measurements higher than that are at increased risk of developing diabetes. So that was one of the main messages in this installation that was shared. But anyway, a beautiful piece, has some lovely articles that underpin it. And I just thought it was a lovely way to depict some of this knowledge, and in such a lovely way. The trial is another one, a UK research-based installation that took place in a courtroom. So again, the importance of place to communicate some of this knowledge that was really around the meaning of the exhibit and the messages that they wanted communicated. They also involved people with lived experience that had experienced the prison system in these monologues. So it was a very engaging, interactive exhibit that allowed participants to not only listen to the audio, to see the visual, to experience what it might have been like for the research participants to have been part of that courtroom. And then in terms of thinking about impact, there were thousands and thousands of viewers who visited the exhibition, and it had a lot of coverage in local newspapers. And again, I would encourage you to go to the website to explore it a little bit further. But again, a wonderful example of a multimedia exhibit that depicted a lot of the results. It was a very participatory piece of work. So the monologues from the men who were the participants who were living in the prison were so incredibly powerful. Heart of the Matter is a local one. My colleagues in Toronto and in Montreal work together, artists, heart surgeons, researchers. And this is just one piece of a larger exhibit that was an interactive sound installation. And this whole study was really investigating the phenomenology of heart transplantation and really testing the hypothesis that heart recipients are likely to experience disruption to their sense of self as a result of their bodily transformations. And this was a very embodied piece of work. So as you approached these vests, you began to hear these audios of the research participants, the heart transplant recipients, talking about their experiences. And as you got closer and more people entered the space, the voices started to overpower each other. And I had the privilege of being part of this installation, and it was just so incredible to hear the voices of the heart transplant recipients. And again, beautiful papers that accompany this lovely installation. This is another installation that has become much more relevant in our sort of COVID days, which really explored the art of immunization. And again, beautiful artists who came together to really try to reveal the role that art can play in politics and the political discourse around life-saving vaccines. And so, as many of you probably know, it's a very controversial issue. And this installation, although it was, gosh, I think it was a couple of decades ago now, really highlighted conveying the qualitative findings of these conversations with people sort of on both sides of the conversation around the pros and cons of vaccination. And again, many, many countries experienced this installation. And I apologize for the background noise. It's garbage day here. So we've got our garbage trucks in the background. So I hope it's not too disruptive. Hooked is another installation also in the UK. again, a wonderful kind of multimedia exhibit. This is just one piece of the art installation that really showcased challenges of addiction. And again, encourage you to have a look, but you can see that my favorites are quite drawing on multimedia. So you can see the visual, it's the use of sound, it's the use of text. So I find them very appealing. The Mockingbird Project is a theater project, a little bit closer to home. So that was a local university here where this co-created play tells the story of 4 generations of women in one family who all experienced severe and persistent mental ill health after childbirth. And it was interesting because the play drew on hospital records of psychiatric hospitals in Sydney in the 1800s, right up to 1955. And the play was also influenced by the personal story of the playwright who had experienced schizophrenia herself. So again, a beautiful amalgamation of lived experience, of historical records, very powerful play. And again, not surprisingly, received lots of local press, was shown across not only Sydney, but across the country. And again, sort of beautiful research articles that that really illustrated the research upon which this theatrical performance was based. And again, this is another one a little bit different, where it was an installation that was showcasing individual journeys with blood disorders. And the panels of the actual installation actually had lines that represented epidemiology and how patterns were drawn from the data. And the focus of the piece was really showing how people with lower socioeconomic status have more challenging experiences with treatment and higher mortality rates. So as you can see, a lot of these installations have very powerful policy implications. And again, encourage you to go to some of these websites and actually have a look at the impact, the actual profound impact that they had on policy and practice, which again, for me is really exciting when you think from a knowledge translation point of view, the incredible impact that they had. And again, one of my favorites, a local colleague from Toronto, worked with a number of artists, heart surgeons, clinicians, to, again, create a beautiful installation that was launched actually on the heart transplant floor of the Toronto Hospital. And it was a beautiful piece of work that demonstrated, I guess, the work as a knowledge translation strategy. So reaching out to physicians and clinicians and patients and their families. But I think for me was really the incredible way that as a research participant and an audience member of this installation, that you really got a beautiful sense of the journey of the patient from diagnosis to post heart operation. So you actually enter the installation and you actually follow the patient journey and really access the elements of the journey through visuals, through poetry. And again, I attended the launch and it was just a beautiful piece of work that had such a wonderful impact, particularly on the main message, which is the title of the installation. So patients saying they don't want to feel like the 7,024th patient. So it was all about personal care and what was really important in care. And again, was that relationship and relational connectedness. So again, powerful knowledge translation messages that, again, I think were very effective. If you go to the literature, which explores some of the effectiveness of the exhibit in terms of changing practice and behavior. So again, really powerful work. So that's, again, sorry, just a really quick tour through some of my favorites. And I think you can see why they are my favorites. They're really powerful, beautiful exhibits. And I think most importantly is the evidence that we have for their impact as a knowledge translation strategy. So now I want to turn to sharing some of the work that my colleagues and I have been doing in our ACT lab here in Sydney. And I really want to start going back to when I was in Toronto, close to 2 decades ago. And this research was really one of my first attempts to draw on the arts to disseminate empirical research. And in this case, it was in-depth, richly textured narratives of 60 young people with psychosis who were sharing their experiences of how they ended up at the first episode clinic, so their pathways to care. And so the resulting 15-minute performative piece was funded by CIHR to be taken to inner city and rural schools in Ontario and Prince Edward Island to enhance mental health literacy and decrease stigma in secondary school students. And I guess for me, what this really, I guess, highlighted was the ways that we can use the arts to share research knowledge. And I guess it really started me on the journey of focusing on the arts in my research program. So for me, this was one of the earliest studies that really, I guess, highlighted the ways in which we can use the arts to have these powerful impacts in terms of changing practice and actually changing behavior. And so for me, this really extended over a number of years in terms of really being able to reach a lot of people and being able to use it in many different ways. So the actual dance became a film, and then we could use the film in different community forums to generate discussions about psychosis, particularly with young people. So this body mapping project, so I'm going to kind of flip over to some of my work that I've been doing more recently, was one of the first research collaborations when I came to Sydney almost 9 years ago. And body mapping, for those of you who aren't familiar with it, is an art practice that involves tracing your body onto a large piece of paper or fabric and decorating this outline by drawing or sewing or painting or collaging or writing on it. And via a very meditative, guided process, participants visually represent their experiences. And so in this case, it was experiences of a physical health intervention to enhance physical health of youth experiencing psychosis. And so the maps were then displayed in an installation that just a piece of it is shown here to communicate with stakeholders, including young people, their families, clinicians, policymakers, researchers, and artists. And what we did in this particular installation, it was held at the National Institute for Dramatic Arts. And we commissioned artists who were affiliated with the Institute to respond to the body maps via an expression of interest. So what we did is we shared one-page summaries of the body maps and the body maps with these artists, and we invited them to respond with their own art genre to these summaries. And this example on the slide here is just one of the artists. We had 26 artists who responded via expressions of interest, and we accepted all of them. So the art installation had one room that we called the red room with the body maps from the young people from our research. And then we had the entire 2 floors of the Dramatic Arts Institute with the artists' responses to these body maps. And that was, again, really incredible. So this one artist, Sophie Dew, this was called Hold Your Heart High. And she responded in particular to the hearts, which were a theme in a lot of the body maps where they use the heart as a symbol to depict their experiences. And this is a textile installation. So in our body maps, the art really occupied an important place. It was symbolic and it was also organic. So it kind of represented the success during the recovery process. It carried images of positivity and hope. And the audience evaluation for this entire exhibit, we had an N of 165, and we showed significant enhanced mental health literacy, increased awareness of psychosis, and reduced stigma 3 months post-installation. So again, you can see these impacts for what, a 2-hour installation where we invited people to come and engage with the installation. So again, for me, really important results. And again, some of these body maps were taken to explore the experience of anxiety. So again, we had a large number of workshops with different groups across the city. So we held body map workshops in art galleries, in our medical research institute, in the university, and actually in the community more broadly. And these body maps were featured in Vivid Sydney, which is an international annual festival of lights. And so what we really wanted to do was kind of reach out to the general public in this festival, and we were able to reach a huge audience of millions. So we have a lot of people coming to Sydney internationally. And the light installation was featured at a prime location facing the iconic Opera House. And we were able to share our research about the ubiquitous nature of anxiety and the strategies that our participants creating the body maps used to cope. And so the installation, as you might imagine, obtained a great deal of media attention, both newspaper and television. And it was a great promotion for bringing together the arts and science. So again, we've really drawn on the success of using this art-based technique of body mapping. And in fact, I edited a text on body mapping and research, which was published in 2021, which really allowed us to bring together a lot of the research on body mapping across different populations and using body mapping in different ways. So using it online, using it face-to-face, using a full body mapping and using mini body mapping as well. And this research that is depicted on this slide here was supported by an Australia Research Council grant. And this funding body is similar to SSHRC in Canada. So it's more of the social sciences research. And this project really aimed to learn about or understand women's experiences of stigma and discrimination and of resilience and survival as a result of mental ill health, disability, and a refugee background. So we were really focusing on intersectionality here. And we found that stigma and discrimination exist on a spectrum from the subtle, like indifference, to the casual, which is more stereotypical, to the systemic, and finally to the overt. And these findings were detailed in a YouTube presentation. And I think the link is there on the slide. And it's also been published in an open access lay-funded catalog. So you can go to see this catalog where we had these body maps installed and read the testimonials from each of our body mapping women. So I will ensure that you have that in the chat if you'd like to go and have a look at that after the presentation. This is a photographic inquiry, and you're going to have an opportunity to engage in a beautiful example following my talk. This particular research project was a Photovoice project by one of my PhD students, and she was really looking to reveal fresh perspectives on disability and wanted to challenge pervasive, limiting negative attitudes and assumptions. And again, a very participatory project where women with physical disability used photography to depict their experiences. What were some of the key areas and assumptions that they wanted to challenge? So women with physical impairment shared their personal experiences and stories through photography. And over a period of 3 months, they constructed these visual responses to 4 feminist topics that they identified themselves: the politics of appearance, sexuality, inclusion, exclusion, and power. And you can see that these photos were absolutely exquisite. We exhibited these photos in a number of different exhibitions in local libraries, in galleries that were in not only inner city Sydney, but we also wanted to reach out to regional and rural communities. So we had the photo exhibit in galleries as well. And I think what was most exciting to me was a webinar that accompanied one of the exhibits with 2 of the women participants. And they discussed in this webinar how each work was constructed, how the images themselves called for greater inclusion. They talked about the need to see and think more clearly about diversity in bodies and abilities and the ways that it can benefit all women. And we collected a number of responses from viewers at the exhibits and from the webinar. And again, audiences talked about the ways in which the engagement with the exhibit and with these women changed the way they thought about disability. And a lot of this work has been really interesting because a lot of our organizations that focus in this space have engaged with these women, have involved them in a lot of their strategic planning. And so it's been really interesting to see the way these women have, from this study, connected not only with each other, but have been really very much involved in a lot of advocacy work as a result of this study. This is another piece of work that we've done where it's an arts project about suicide and imagining the future. And it was led by artists with lived experience of depression and suicidality. And the finished work was a mixed reality piece of work that was a 10-minute engagement with ways to engage in other, I guess, other spaces to reimagine a positive future, so that the project really involved different landscapes so that you could actually control whether or not you wanted to be on a sunscaped a mountaintop, whether you wanted to be in a rainforest, whether you wanted to be in a, in a tropical forest. And we had an intervention. We had a waitlist control group where we measured positive mood before and after experiencing this VR experience. And our research across different settings showed significant increases in positive mood following this intervention. So again, really using very different art forms to explore the ways that we can actually measure whether or not engagement in these art forms can actually have an impact. The Hive is another immersive art installation that was displayed at an international health symposium. And it was an arts-based knowledge translation initiative that was developed collaboratively between artists and researchers and clinicians and healthcare consumers. And each project that featured in the Hive drew on different art forms. So we had textiles and sculpture and poetry and video, and they highlighted the many ways that the arts can enrich conversations on healthcare and how these different research projects and the results can be communicated using visual, performative, and literary means. And again, the very specific projects and research that was highlighted in the Hives are described in the reference that's given at the bottom of that image there. Here's just a better sort of image of the Hive. So you can see that it was very large. It was 10 meters by 4 meters. And viewers can actually immerse themselves in the Hive. And so each section of the Hive featured one of 8 different projects. And they were different research projects that were everything from child ADHD to palliative care. And again, using very different art forms. And so we were very interested, of course, in what was the impact of 300 people who were at this at the symposium and who engaged in this installation over the 3-day symposium. And here are just some of the qualitative comments from our audience, but we also had audiences complete different surveys, and we had a lot of information around the ways in which they were impacted by engaging with the Hive. And we had a lot of people with lived experience who came to the symposium and could see their own images and their own artwork and their own experiences depicted in this way. And so the Hive has kind of morphed on. And so this is this original Hive at the symposium was 2019, and we are still adding on to elements of the Hive and displaying it and installing it in different hospital settings across the country. One of our more recent projects that was funded is Culture Dose for Kids. And social prescribing has become quite commonplace across the globe in terms of really trying to address social determinants of health and mental health and how we might move beyond the formal mental health system to engage people in non-stigmatizing ways to impact their overall mental health and well-being. And this is an arts intervention and engagement program that's in partnership with the Art Gallery of New South Wales that's targeting 9 to 12-year-olds with anxiety and their parents. So they've come to the Art Gallery over an 8-week program that really focuses on both creation and engagement with arts. So it's a program that's 2 hours over the 8 weeks that was co-created with young people and their families, and really based on the Australian longitudinal study of children. And we took the 8 main worries that young people that cause young people anxiety. We flipped them to the positive so that each one of the sessions focuses on, for example, climate distress has been flipped to immersion in nature. So they engage with 3 really carefully curated artworks that depict that theme. An arts engagement facilitator really engages them in sort of meditative practice, in looking sort of deeply at the artworks. Their parents are taken on a parallel kind of engagement, but they're separate. They come together for morning tea, and then they create based on those or inspired by those engagements. And again, we've seen remarkable decreases in anxiety over the 8 weeks. We've seen 90% engagement rate, so that, you know, at week 8, we've got 90% of our families who've stayed with us across the 8 weeks. This was philanthropically funded, and our philanthropist came at the 8th session in our first round, and they were so impressed after talking to the young people and their parents. They asked us to write another proposal to bring this Culture Dose for Kids to regional and rural communities and regional art galleries, so that particularly disaster-affected communities where young people and their families were particularly experiencing mental ill health. So again, just an example of sort of moving more into the arts intervention, and how important these interventions are to sort of think about interventions that are outside of the realm of the formal mental health system. So we have a waitlist randomized controlled trial underway at the moment. And our preliminary results from that are very, very positive as well. So really excited about this work, working with young people and being able to see some of these wonderful and powerful results. So these are some of the initial findings from our pilot programs. And I think one of the most important sort of unanticipated findings was the way that the families connect with each other, and these connections endure beyond the intervention. So these families are continuing to connect, parents with each other and young people via play dates, the way families have organized to continue coming to the art gallery after the formal trial is over. So again, I think a really important and unanticipated finding. Crafting Care is another recent project, really focusing on craftivism, which is a gentle form of protest that appeals to people who might not identify as activists, but still want to make a positive difference in the world about an issue that's important to them. And so in this particular study, workshops were held with people with lived experience of caring for someone with dementia. And really, the important questions that we were asking here were, what are the key issues or experience that these carers wanted to communicate, and to whom? And also really interested in process. So in the process of making together as craftivists, what have been their experiences? And they expressed the difficulties that they face in their experiences of dementia care, from stigma and isolation to a lack of support or insight from health professionals and the care sector and society at large. And these were all issues that call for recognition and change. So again, thinking about that activism component. But also, the carers also held on to joy, which I think was really important. And this installation, like many of our others, has been exhibited in many spaces, both city and rural, formal and informal. And so again, the ripple effect is something that we're really interested in. And we've more recently focused on mental health and climate change being 2 of the biggest challenges that we face today. And we're really interested in community-focused activities that bring these 2 together. And we've done, interestingly, you can see in this image, body mapping in the community, where in terms of creating the body maps, we've been using found objects from nature and from the community. And in engaging the community and creating these body maps, being able to talk about their climate emotions and kind of the strategies that they use to deal with these climate emotions, and focus on socially connected and safe ways to support mental and physical health for these communities. So we've been really keen in promoting this area of work, and currently are in the grant writing mode in terms of trying to bring these together, which has been really fascinating because, again, we've always worked very sort of multi and transdisciplinarily, but now we're bringing in geographers and people from the built environment. And it's been really interesting to see the ways that different ways of viewing can bring to solve a research challenge or a problem. So I am going to stop there and stop sharing my screen, and really excited about the next stage of this webinar. Thank you.
Thank you so much, Katherine, for that wonderful presentation. I think it's always nice to have these tangible examples, and the fact that you provided links really gives people an opportunity to go back and revisit these examples. So thank you so much for that wonderful introduction. I'll turn it over to Vidya to introduce our next presenters.
Thank you. Thank you, Katherine. That was really wonderful. And I'll introduce the next. And we've also built in a lot of time for questions and answers and discussion. So as soon as this next part is done, I'm sure you have questions and reflections for Katherine's presentation. Doctor, if you can wait, and after this one, we'll take time for both questions and discussions for both parts of the presentation. It actually gives me great pleasure to introduce two people I've worked with for many, many years now. So the first is Yvonne Pelling, who's currently the Patient and Community Engagement Lead at PASSERELLE, which is CIHR SPOR's national training entity. And she was the chair of the Access Open Minds Family Carers Council, and really the co-lead for the Photovoice project that she and the Youth Council proposed, led, really have been involved in from the beginning. And I also want to introduce to you Marilena Liguori, who's a qualitative research assistant who works with the Access Open Minds team. And she has a rich multidisciplinary academic background and has been working very closely with Yvonne, Alyssa, and others on this project in Photovoice and in general on various topics related to qualitative research. So over to you both.
I'm going to share my screen. It's actually with a lot of gratitude that I get to present this Photovoice project. This project is actually quite near and dear to me, and it set me on a journey and a path that wouldn't have happened unless I had undertaken it with the amazing group of people that that really did this with us. And it's so large, I can't possibly name them all, but I do want to make a special mention to Alyssa Frampton, who is not presenting with us today, but who did like an enormous amount of work in this project, and we really couldn't have done it without her. So as Vidya mentioned, it's myself and Marilena who will be presenting the project. And this is just a little agenda for today. So we'll just go over what the project's about, how we undertook it, some of the results, and then we're going to do a little activity with you as well.
Okay, thank you, Yvonne. And I also would like to say that I'm very grateful and fortunate to have had the opportunity to work on the Photovoice project. I came in later on in the analysis phase, but I had a great deal of pleasure working on this project as well. So just a few words of, you'll probably hear us mention, of course, Access Open Minds. So just a few words about what Access Open Minds is. A pan-Canadian youth mental health research and service transformation network that is funded under the CIHR strategy for patient-oriented research. And so one of the key priorities of Access Open Minds is the collaboration with partners and including youth and family carers to co-create transformed mental health services based on lived experiences. Experiences and perspectives. So actually embedded in the governance structure of Access Open Minds were the Youth Council and the Family Carers Council, as well as the Indigenous Council. So as Vidya and Yvonne mentioned, so the members of the Youth and Family Carers Council proposed leading a Photovoice project, which was really aimed at empowering and engaging youth and family care voices, fostering relationship building among these partners, and allowing them to share their unique perspectives through the lens of the camera. And so the Photovoice project was designed to address also the challenges surrounding the engagements of partners across diverse, unique settings, and to explore transformations in youth mental health. And so we're going to describe a little bit later on in this presentation actually how the different phases of the Photovoice project.
So Access Open Minds has 17 sites across the country, rural, urban, and Indigenous locations. And so we had many of these sites participate within the project.
Okay, so the Photovoice project, so that is entirely a stakeholder-led project that is based on the train-the-trainer model of meaningful partner engagement, and as well as the creation of a supported peer researcher network to carry out Photovoice project at each of the Access Open Mind sites across Canada. So the project itself was carried out in 4 phases. So the first phase consisted of a workshop facilitated by Youth and Family Care Council representatives, where participants received hands-on training in the Photovoice methodology. And participants also gained experience on how to conduct a Photovoice project and learn the steps involved in implementing a project at their site. The second phase consisted of the peer researchers conducting the Photovoice project at their respective Access Open Mind sites. And so participants were asked to take photos with a central question, which we will describe later, and write a short narrative describing their photos, as well as take part in a group discussion. The third stage of the project was an online survey that was administered to the peer researchers regarding their experiences of carrying out a Photovoice project at their sites. And the fourth stage turned out to be an online virtual gallery due to COVID-19 restrictions at the time. And this gallery is available on the website and the link that we will share in the chat. Okay. So moving along. So we just wanted to give a portrait here of actually what the role of the peer researchers was in the Photovoice project. So the peer researchers were responsible for recruiting participants, facilitating the learning before the participants could take photos. So basically explaining some tips about how to share your story through photos, going through questions about ethical considerations and obtaining informed consent, ensuring that participants have whatever they needed to carry out the project, as well as supporting participants taking photos on depending on what the site had chose, either a specific day or over a series of days, as well as facilitating the focus groups and then sending back the photos and data collected to the Access Open Minds central office team.
So there were really 2 main objectives of the Photovoice project. The youth members and the family members really wanted to do a collaborative project together. And this was really the first time during the Access Open Minds project that we had a chance to do something together. And we really wanted to make sure that we highlighted the voices of youth and family members who were involved in the Access Open Minds. So the main question that we asked during the Photovoice project was, what does youth mental health transformation look like to you? So this is the overview of all the data that we have collected. 9 of the sites participated. 17 participants were involved, and they were comprised of youth members, family members, peer support workers, staff members, and community members. We have a total of 190 photos. Here you can see that this is where our online exhibit is, and of course we have the survey information.
Okay, so in terms of methodology, the technique that was used during the group discussions among the participants was based on the PHOTO acronym method. So basically, participants were asked to describe their photos, to explain what's happening in the photo, to explain also why they took the particular picture and what does that picture also tell us about their life, and particularly with regards to opportunities to improve the youth mental health services. So we were able to collect quite a rich amount of data thanks to the group discussions.
So the data analysis really happened in 2 phases. The first phase was about transcribing the group discussions particularly the parts where participants were describing their photos and what they aim to convey regarding the actual question of transformation. And the second part was really a metacognitive dialogue between researcher and participant, where we looked at the photos and had a dialogue, we looked at the narratives, we had a dialogue, and we looked at the group discussions and had a dialogue. And then we cross-compared what we felt and what came out of that to identify various themes.
So after this data analysis process, we came up with three main results. So we identified three main themes. So the first theme here is a transformation of the self. So always related to the main question, what does transformation in youth mental health services look like to you? So in terms of transformation of the self, this referred mainly to the journey that an individual experiencing mental health issues embarks upon as they navigate the road to wellness. This journey often starts with a crisis situation or with a deep desire to make changes in one's life. And transforming the self is a process of learning. So we chose a couple of pictures here that we felt stood out for this theme. So the first one here of the bird looking out. So I'm finally free now that I've worked towards my recovery. I can finally spread my wings. And the other photo, which the participant who took the photo shared, I was standing on the edge of an icy patch, deciding whether to cross the path or go around. The ice was so pretty, but also could be dangerous. Always deciding whether to take the dangerous path or take the easy way around. Don't be afraid of the unknown. It may be scary or difficult, but may be worth taking a chance. Okay, so the second level of transformation that we found was transformation of community. So here, transformation of community highlights the value of support received from various sources, be that friends, family, community members, clinicians, and even pets. When the community comes together, this becomes a source of strength. An individual can lean on others, not with the expectation that they will do the work for them, but for respite, encouragement, and understanding. Support can help reduce stress, build self-esteem, and increase one's ability to cope with the ups and downs of life. It also allows people to develop social networks and to become active agents of their own change. So the photos that we chose today highlight these sources of support. So the first one, I found this in an alley. It turned out pretty cool. The reason this spoke out to me was because of the hands, mental health, and people. Our youth are reaching out for help. They want to make changes. This is a perfect example of a youth reaching out for services, and we're reaching out to them to give them from the services they need or want for them or their families. And the second one highlights family support. So linking together helps create strength. Each link supports the next link. Even though it's rusty and weathered, the trials of support a young person with mental health and addictions can be challenging, but staying linked to each other and each other in the community helps us stay strong. Staying connected helps people improve mental health. And finally, the third level of transformation is regarding the services themselves. So transformation of mental health services refers to a personalized approach to the development and delivery of culturally sensitive and inclusive services. It is important to consider then that each person's experience with mental health issues is unique. And just as the individual embarks on their transformative journey, the mental health services system will also need to embark upon its own journey of transformation in order to adequately meet the needs of service users and their families. So the common thread between youth and families in this study was that both groups wanted to be seen and heard in the youth mental health system. So transformation is about the system's willingness to address their needs rather than offer a one-size-fits-all solution, as well as the commitment to be available for as long as someone needs it, to be appropriate, and to adapt when necessary in order to be meaningful. So the first picture here shows a smudging ceremony. So to me, smudging is the first thing that comes to mind when I think of healing and mental health in our community. And the second photo highlights also diversity and inclusion. The next one is the building with a bunch of nations, cities, and flags on it. It is supposed to show that all across the world, people have mental health problems. It's not just certain places, not just certain people. Everyone can experience it, but you might not know. it's not that only some people need help with it. Most people that have mental health issues will need help. It's not just a few people. To realize that other people need help too and to turn them away, it'll make them not want help anymore.
So when you do go online, this is what you'll see. And each of our sites that participated does have its own book, and you can flip through. They're both in French and English.
Okay, so what we wanted to do today was we wanted to do a mini Photovoice project with all of our participants here in the audience. So feel free to participate. Basically, the main question that we've come up with today that would be guiding the photos is, what is one intention that you would like to set for 2024? So if you would like to participate, maybe just take a few minutes now to take a quick photo of where you're located right now. And then if you want to, you can share your photo at the end and discuss how it relates to your intention for 2024.
There was like a 90% like engagement rate by the end. And then you had also mentioned in a different project that it was displayed at a big kind of festival in Australia. Can you just kind of speak about how you have overcome the challenge of engagement, it seems? Because I feel like that might be a problem or a challenge that is frequently encountered.
Yeah, thanks for your question, John. I mean, absolutely. In fact, when we were designing the Culture Dose for Kids program, it was really in response to the fact that when we did a sort of a scan of the literature, we couldn't find anything on arts on prescription for young people specifically. And so that was sort of our decision to focus on that 9 to 12-year-old age group. And I guess just the percentages of kids in that category that were experiencing anxiety that was interfering with their, with their family life, with school. And we thought, because the initial intervention was with the art gallery, so it was actually physically taking place in the art gallery. So we were like, well, these 9 to 12-year-olds have to get to the gallery. How are they going to do that? We've got to engage their parents. And so we brought the parents into the foray and had sort of a parallel program for parents as well. So it's not like they dropped the kids off and left. So they were also involved in the programming, which I think was really important, because it was a time, in talking to them and interviewing the parents afterwards, it was a time out for them where their kids were involved elsewhere. They had that time to reflect, to engage in artworks, to talk with other parents. So I think that was one piece that kind of enhanced our engagement. So the parents were very involved. I think the other piece is just that they were really desperate for something for their kids who they were dealing with these sort of elements of anxiety. And this was something that was accessible. It was non-stigmatizing. For many of them, it wasn't that they had ever even been to the art gallery previously. And so we were really worried, how are these research participants going to be coming? And we had 22 in the first trial. Are they going to come every week on a Saturday morning, from 10 to 1? And they did, they did. And that, we would have, maybe one family might not make it to session 3 because they had soccer or whatever for the kids, but it was like this same group of families throughout. And because we've expanded to these rural communities, we found the same thing. It's something that they look forward to doing, that it's fun, it's engaging. So it's a little bit different than maybe a typical research study. So it was a bit surprising, because of course we expected a lot more drop off than we had. And even in fact, because we had a waitlist control group, so they didn't receive the intervention, but we were still, implementing our surveys with that group. I think just knowing that this was coming up, we still had them all sort of ready to roll when we had the next intervention for the waitlisted group. So we've kind of seen it in terms of really good retention rates over the course of the group. And again, I think it's because we've got really skilled arts engagement facilitators who really bring people in, make them feel comfortable. It's a comfortable, safe space, So that's been really good. And with respect to your other question around the festival, I'm not sure if you're talking about Vivid, which is the light festival that's held every year here in Sydney, where we have the body mapping. Yeah, the body mapping installation. Um, as part of that festival, there's kind of an expression of interest about 6 months beforehand for art light LED installations. And at that time, we were working with some installation artists who were helping us with the Hive installation that you might remember I described. And they were really interested in some of the body mapping work we were doing and said, look, we could create a really interesting light installation inspired by maybe 5 or 6 of your body maps. And so we went back to some of the body maps and they actually recreated the body maps on these plexiglass, big, huge plexiglass units, I guess. And really, the idea was just to create a conversation with the general public about anxiety and how it affects everyone at some point in their lives, at some level. And it was really interesting because, of course, Vivid Sydney is 3 weeks. So we had 3 weeks with our installation in a really prime location. And because Vivid has volunteers at each installation, we had our volunteer feeding back to us what people were talking about. And we hung out and did some participant observation at the installation. So it was a really great way to kind of create a conversation about mental health issues in a sort of light installation where it was very much outside of the formal mental health system.
Cool. Thank you very much. I really enjoyed your presentation.
Thank you.
Thanks. I see Nicole, you have your hand up. You can go ahead in front of me.
Thanks. Hi, Katherine. Nice to see you again, and thanks for the wonderful presentation. I actually have a question relating to the process of engagement with getting projects like this with the art base and art engagement throughout and in KT. How do you, 2 questions. How does one who's mainly based within a research institute or a research realm budget for such activities? And then the second question is, what is the actual process of having, this line between research and art meet? I'm so curious on how you managed to get the installations into large museums and exhibitions. And what was that process of engagement for those who may have an interest but don't quite know what kinds of paths to take?
Nicole, yeah, nice to see you, and thanks for your questions. Yeah, I think we're really fortunate because in my role as Director of Knowledge Translation for the Sydney Partnership for Health, Education, Research and Enterprise, which is a real mouthful, has been the decision latitude to do whatever it takes to share research knowledge among this huge partnership. And I guess the funding that came with that role in that partnership over 5 years was fairly significant and allowed us to bring on board 10 artists in residence. So that's been a huge, it's just bonus in terms of having the funds to be able to support our artists. So for different projects, we can, they're part of the research study. So they're employed by us. And so they're involved in the research from the outset. So it's not like we have the research, we've got the study, now we're looking for an artist to help us to disseminate. So we have this cadre of artists, textile artists, photographers, sculptors, actors, poets. So it's absolutely, it's fantastic. And that obviously the funds for this project aren't going to go on forever either. So sort of anticipating that it's got a shelf life in terms of keeping our artists in residence on board. So any grants that we apply for now, we actually build them into the research projects. If they can't be co-investigators, they're partner investigators, or they're built into the budget in some way, so that we've always got a budget for our artists to be able to work with us. So that's been helpful. In terms of the second piece about the partnerships with the galleries and how do we get sort of the Art Gallery of New South Wales to have these programs. And I guess it's part of, as you might imagine, sort of the time to build relationships with sort of the key people in the galleries. So I guess when I first came to Sydney, connected with the arts engagement officers there. And I guess one of the, advantages is that the art galleries and museums as a rule right now are very much into reaching out to communities, and they're all about sort of arts engagement, bringing the communities not only into the galleries, but having the galleries go out into communities as well. So I think we can kind of put up our hand and say, look, we can help you with that strategic objective here, you know, because they want to partner with other groups, and sort of that really realizing that we can help them to do that. So I think that went a long way towards actually, you can imagine having an arts on prescription program in the gallery and then having the artworks produced featured in the gallery. I mean, you know, people are quite proud of these works. So I think that's been really helpful in terms of the social context of the galleries and sort of their strategic objectives to actually to reach out to be more engaged. The whole thing of sort of the relational aesthetics and engaged, socially engaged art really plays into this, and we kind of capitalize on that, which makes it a lot easier. So they're very much involved in our research as well. Not to say there aren't challenges, because there's a lot of IP issues and memorandums of agreement, and there's copyright with the images that we use in our programming, and that takes time to get the copyright, and there's costs for some of the copyright if we want to use newer works. So all of these sorts of things that you might not anticipate that you have to kind of work around and deal with, but they're not insurmountable, that's for sure.
Thank you.
So I had two questions, one for Yvonne and Marilena, and then one for you, Katherine, around challenges. So I was wondering, Yvonne and Marilena, if you could speak to some of the challenges that you had to overcome during the process of implementing Photovoice. And then, Katherine, my question to you is, well, Nicole kind of asked a little bit about this, but I'm curious how you kind of get the buy-in from funders for arts-based approaches. And I'm wondering if you have had any like pushback on this kind of approach, because it's rather innovative and perhaps people haven't really, it's not something that's like maybe seen as often. I think it's changing obviously right now, but yeah, it'd be great to hear your insights on how it's changed over time. So over to you, Yvonne and Marilena.
Maybe I could start, and then maybe Marilena, you can also add to it. I think actually one of our challenges, and really it was more of a learning curve than I would say a real challenge, was that we as youth members, family members, the central office, you know, and all the people who were involved in the project really had to learn how to work together. This was a gigantic project. And so we had to figure out who was doing what, when, where, how it was all going to unfold, get all of our ducks in a row. And sometimes we stepped on each other's toes. But that to me really is about, you know, learning together. And so was it a challenge to learn how to collaborate? Sure, it was a challenge. But we did it, and I'm glad we did it.
I'll come in for, you know, responding to your question. Absolutely. In terms of responsive funders, I have to say it's actually more challenging here than it was in Canada, particularly with our healthcare funder. So the strategy really has been downplay it and playing the game a little bit. The expectation, particularly of healthcare funder, is innovation is not taking risks. Innovation is doing the same traditional things. Expectations around, you know, if you think about the hierarchy of evidence in the randomized controlled trial. So we try to just play the game by using mixed methods and incorporating them when they make sense, because I'm just a believer in there are many different kinds of knowledge, and there's a role for all types of knowledge, and they all contribute to a piece of the puzzle of understanding whatever the phenomena is that we're exploring. So I think the NHMRC equivalent of CHR is a hard nut to crack. It really is. So I'm still working my way around that. They have sort of a newish opportunity called Ideas grants, where the expectation isn't for an RCT. And I've tried a couple of times, and I'm just like a near miss. So it's just trying to break that. It's fine when I'm a co-investigator and I can bring the arts in on other people's projects and it's a piece of it. But when it's its own thing, it's really challenging. greater success with Australian Research Council, which is the SHORC equivalent. So again, more in the social sciences, that's not been as difficult. So they funded our body mapping work and other work using the arts. So that's kind of the funding landscape. Lots of advocacy work, working together with arts organizations, health organizations, trying to bring the two ministries together. So, policy documents, we've gone to, to Parliament House, and we've made presentations to sort of both groups to say this is really important to bring these together. So it's a work in progress. I think it's moving in the right direction, but it's a hard challenge. It absolutely is, no question.
Thanks, Katherine. Marilena, I don't know if you had wanted a chance to speak on Photovoice, but it's there if you'd like it, or I'll just go to the next question.
Yeah, that's okay. You can go to the next question.
Okay.
Kat, there's also a question on the text and
yes, I see chat. But Lori's hand has been up for a while, so I just want to give that the floor to her. Oh, Lori, you're muted.
I'm sorry. I'm going to be really fast, but I just want to let you know that I was part of the Photovoice project when the youth and the family brought it back to Chatham-Kent. And it was such a beautiful space to hear about feelings from the youth. Even the family members were saying they had no idea that they were feeling the way they were. And even their dreams for the system, they were really inspired by their kids' thoughts around that. And so I just want to say it was hugely impactful. And, after that couple days together, everyone said, we have to do this again. So, and, it hasn't happened. So it makes me want to, get a group together that we can just start, even a small group, and, go to CMHA, to a staff meeting, maybe. There's power in a story, and these are definitely stories and captured in a photograph. So it's really inspired me to get a group together and do this, even on a small scale, and then talk about what are we going to do with this now? Who are we going to talk to? So thank you so much for a great presentation from start to finish. Thanks so much.
Thanks, Lori, for that lovely comment. We do have a question in the chat. I'll read it out. I know, Katherine, you started answering it, but I'll read it out in case you want to further elaborate. So this is from Julie Kane. The question is really around the analysis frameworks, discourse analysis, thematic analysis, IPA, etc., that are being used in some of these. What are you using generally? And if multiple, which are you finding most useful or intuitive with the arts-based works?
I guess I put in my comments sort of it depends. It really depends on the work, but we do use reflexive thematic analysis a lot because much of the work is so participatory, and engaging in reflexivity with the team is really valuable. So it's very much aligned with the Photovoice that was presented today, because it's really, I love the way in your analysis you really brought the different perspectives together in that beautiful way. And I'm sure just that kind of reflecting, that personal reflection, that sort of what do you bring subjectively to the work, and not to try to get rid of it, but it's your worldview is going to contribute to that analysis. I guess I didn't mention, we also find Julie and Rose's work on visual analysis helpful because it gets you to think about the different levels of the visual and how do you integrate the visual and the textual together. And with body mapping, there's a lot of that work because they're so combined. So again, yeah, it really does. It really depends on what our goals are and what we want to draw upon. I guess one thing just to put it out there, the one thing I don't use is I don't use grounded theory. I haven't. It's not to say that you couldn't. I think it's justifying what makes sense given whatever the particular goals and type of work it is. So I don't think there's any right or wrong answer to that. I mean, discourse analysis could be really, really interesting, and we certainly have used it in the past as well. People are really interested in kind of going that route. So again, I think I'm sort of not a methodologist that has only one form of analysis, and that's all that we use.
Awesome. Thanks so much. I really appreciate that.
Okay, so I know we're at time right now, but I guess we'll charge on through for maybe like one or two more questions. If you do have to leave, of course, definitely go ahead. But thank you for those of you who have stayed this entire time and participated in the webinar. It's been wonderful. Just very quickly, I think Jessica and Vidya had questions, so I'll let them ask their questions. Go ahead, Jessica.
I guess this is a question for Katherine. Thank you so much for your presentation. It was fascinating. And I guess I was wondering if you could speak to if there's any projects that you've been involved in or that you know of that are from maybe non-Anglophone places or collaboration from other countries or other languages. Just curious.
Yeah, one of the projects I was involved in that I didn't feature today was using social circus with young people. So it was a project with colleagues in Canada and Ecuador, and the research was really focused in Ecuador. So it was on the, it was young people and actually policy folks because it was funded by CHR, but also by the Ecuadorian government because they were really keen to take young people who were in marginalized housing or on the streets, off the streets and engage them in social circus. And so that project was very arts-based. So we used Photovoice, we used social circus, sort of as a performative piece to work with young people and engage them in sort of capacity building around social circus. So that piece of work was sort of with the Global South. And that culminated in a book and some articles and really a good opportunity to, particularly in the book, use a lot of that arts-based work. So I think there are a couple of chapters that focus on the arts-based components and really allowed us to use a lot of visuals because there was a lot of photography that was part of that project. So that's one example, but certainly I know that particularly with a lot of funders and Wellcome Trust that their focus really is on the Global South and lower middle income countries. And it's nice to see that there's, the identification of that as being a real gap in the research base.
I had sort of a related question. The arts have always been an interesting kind of, on the one hand, it can be a way of like democratization, activism, like, bottom up, like giving voices to people who are oppressed or marginalized. And yet we've also seen in general arts can be very much like, like who gets patronage, who gets like, it can be also like where the same sort of issues of elitism or whose voice gets counted. I was curious in arts-based research, like if you've had like any reflections in general on cultural safety and decolonization and really thinking about this a bit more. And because sometimes I think there might be a tendency to assume that if it's arts, it's automatically a lot more culturally safe or it's decolonized. And I don't think it's automatic. I was just curious if you have any reflections on this.
Yeah, great question. And absolutely do. In fact, a couple of years ago, we engaged in story completion method. So if you're not familiar with that, it's just, you have a story stem, and then you ask your research participant to finish the story, and then you analyze those stories. And it allows people to not be reflecting necessarily on themselves, but it could be on whatever particular issue is. So we engaged in a story completion study, and the story stem was something to the effect of, Allie receives a phone call at 11 p.m. from a parent who is has some symptoms and is distressed that it might be COVID. And so they finished the story. And so we analyzed the stories and we ended up writing a paper on the ways in which our respondents, it went out on social media, our respondents were very non-diverse, and how we really needed to address these issues of ensuring sort of cultural competency in our work, and how would we change the story. And one of the things was around our Western views of storytelling with beginning, middle, and end. And the story completion method assumes those kinds of Western ways of telling a story. So as part of that paper, we made recommendations for how might we change the way that story completion works to be more embracing of diversity. And so right now we just got ethics approval to do a story completion study where it can be anywhere in the story. It can be the middle of the story, the ending of the story, and just see whether or not we get a more diverse group kind of thing. But absolutely, those are really critical issues. And I think one of the things semi-related to that is around people's reticence to get involved. If you think about body mapping, for example, you've got on the floor this larger than life, huge piece of blank paper or fabric. You know, and people are thinking, oh my gosh, I'm not an artist. And that's usually what you'll hear. I'm not an artist. You know, I can't do this. And again, I think that's where the facilitation comes in, because the body maps produced are like exquisite. And, you know, and these participants aren't artists, but I think it's that guided process and facilitation. And so yeah, I'm not sure if I'm answering your question, but
No,
there's so, I mean, there's
thank
so
you.
many, you know, wonderful
It's a
issues.
multi-layered, yeah, but thank you
Yeah.
so much. That was fabulous.
Thank you again for such a rich discussion, these great questions, and just wonderful presentations. Thank you to those of you who stuck out 6 minutes over our own time to hear out this discussion. Really grateful for your participation, and for those of you who shared with us your photos earlier on. So yes, a big thank you all around to everyone, presenters and participants. I hope you're walking away today from this webinar as inspired as I am, and thinking about how arts-based approaches can be applied into your own line of work. I just want to do a little brief kind of blurb for our next webinar, which will also be focused on arts-based approaches, but we'll do a deeper dive into digital storytelling and self-filming. So watch your inboxes and social media platforms for upcoming details. So I'll definitely be in touch. This has also been recorded, and so I'll be, again, putting this out on social media and also emailing people this recording and a short summary for those of maybe colleagues who have missed the webinar today, so you can expect that as well. So I hope everyone has a good rest of their day. Just merci encore pour votre présence et votre participation. Thank you, everyone.